Okay. Hi, everybody. My name is Olivia Allison, and on behalf of the Center of Hospitality Resilience, I would like to welcome you all to today's webinar on proactive strategies to ensure event success in a crisis. This webinar series is intended to support small tourism and hospitality businesses as they navigate these unprecedented times as a result of COVID-19. By exploring topics related to operations, health and safety, marketing, risk management, contingency planning, and innovation, we hope to provide meaningful and relevant insight in relation to current small business issues to help you understand and respond to the changing landscape. This series is brought to you by the Center of Excellence for Hospitality Resilience, which is a joint initiative of Temple University's School of Sport, Tourism, and Hospitality Management and Temple's Small Business Development Center. This presentation is recording, and a follow-up document will be sent to all attendees. And all attendees have been muted, but we do encourage you to post any questions you have in the chat box, and at the end we will get those answered for you all. So now I will turn the floor over to our panelist today, Ira Rosen.
Great, thanks very much, Olivia. I appreciate the introduction. Just a little background information on myself. Obviously, you can read the slide. I am an associate professor in the School of Sport, Tourism, and Hospitality Management, and also the program director for a very successful and world-recognized Event Leadership Executive Certificate program. So I have the joy, and it is really a joy, to be able to teach in a variety of different spaces. I teach primarily, in fact, only event leadership and event management. I teach it to undergraduate students. I teach it to graduate students. And I teach it in our executive education and continuing education program. I also spend a lot of time talking to colleagues around the world and presenting webinars, and certainly in these days, talking a lot about where we are as an industry and where we want to be as an industry. I am not a trained academic. I did not start out my life to be a university professor, although I am very fortunate to be one right now and count my lucky stars every day. I have been an event producer and an event consultant literally all of my life. I got bitten by the event bug, part of the analogy, when I was a college freshman 1,000 years ago. And that's all I have done for my entire life. So although we'll talk about some academic kinds of things in this presentation and get some, academic-ish definitions, really want to talk about some practical applications and the things that all of us can do, no matter the size of your business, no matter how small you are or how large you are. And again, this is a small business initiative, but most small business entrepreneurs that I've met throughout my career, having been one of those, really want to be large-scale, entrepreneurs at some point in their life. So the definition small does not mean from a thinking perspective. Small businesses are the core of what we do, particularly in the world of tourism and hospitality and events, event venues, event operators. So, from my perspective, there's nothing small about what any of you do. I just want to talk a little bit about this, about the title of this. Olivia and I were just chatting a little bit before we got started today, and it's kind of a weird title to some extent. It doesn't necessarily explain what it's about. We will define the word strategy in a little while. We'll define the word proactive in a little while. But I just want to talk about this concept of ensuring event success. If you're here to get a 100% guaranteed successful strategy, sorry, I don't have that. I'm not that good. Nobody that I know in this industry is that good. There is no guarantee that anything we talk about today will be successful in the future. So if you're here for guarantees, I'll apologize in advance. But what we will do is talk about some things that we can do going forward, things that I've learned in talking to people around the world about what's going on. I also want to do a quick disclaimer before I get started. I just want you to know I'm not a doctor, I'm not a lawyer, I'm not an accountant, I'm not a government official, I'm not a scientist, and I'm not an insurance agent. So some of the things that we talk about today will certainly affect those industries, and I definitely recommend that if you have specific questions about insurance, specific legality kinds of questions, I can certainly try and answer them towards the end of this when we have kind of a question and answer period. But by all means, go ahead and consult with those people to find out specific answers. Again, we are all crawling through this thing on a day-to-day basis. And that's kind of the other piece of the disclaimer, is that what we talk about today can be completely changed by tomorrow. If I had given this presentation a week ago, a lot of what we talked about might be very different. One of the challenges, the many challenges of living in this pandemic, is that we don't have a ton of answers. We're all kind of fumbling through this thing together. But what I want to talk about is the fact that you need to stay educated. You need to stay current with what's going on today, because that changes each and every day. So be aware of what's going on around us. Pay attention to what governments are saying. Again, you know, things are slowly opening up, and hopefully for those of you, that may give you some signs of positive kinds of things for the future. So again, all of those things being said, we'll kind of jump into the presentation. So before we start talking about, you know, strategic things that will ensure your success, I think it's really important that we're all on the same page with regard to definitions. And I like to start almost every class or every seminar that I do with some level of definition, because if I'm talking about something and I'm referring to a word that you have a different idea of what the meaning is, it's not going to be really effective for you. So again, as I said, I'm not a trained academic, so my nature is to keep my definitions as simple as possible. Okay? So 4 words that I want to chat with you about, and we'll look at these throughout the course of the next, you know, several, you know, half hour, 45 minutes that we have together. We see these 4 words all the time. They're very applicable to the event industry, to small businesses, particularly in the world of tourism and hospitality. So goals are end results. Objectives are the measurable means that we use in order to get to those goals. Strategies, which we'll be talking about today, are about thinking things through before doing them, kind of that idea of having a plan in place. And a 4th word, which we'll also talk about today, are tactics, which are some of the detailed things that we do in order to execute our strategy. So there's 4 words that we use all the time. The way that I like to explain this, because I like to keep things as simple as possible, because I'm a relatively simple person. I don't like to overcomplicate things. You know, in the world of hospitality, certainly in the world of events, the simpler we can keep things, the better. I like to use the analogy of a GPS. We all live with our GPSs, whether they're on our phone or in our cars or both. So if we think of these 4 words in terms of a GPS system, the goals are our destination. So if we were doing this live today at Alter Hall at Temple University, and let's all hope for the days when we can do that again, our destination might be 1810 Montgomery, okay? Or 1810 13th. See, I don't even remember the address anymore. So we plug that in. That's our goal. That's our end result. The objectives are the turn-by-turn directions that we use in order to reach that particular goal. So, you know, make a left here, make a right here, go straight for 2 miles in that obnoxious voice that none of us can stand anymore in our GPSs. Our strategies are making sure that before we get into that car, we know that we can get to the destination, that we have enough time, that we have enough gas, that if we're water drinkers or coffee drinkers, we know where the restrooms are. So we've thought that through before we get in the car. And then the tactics are what we do when we see obstacles that get in the way of us executing our strategy. So for example, an obstacle in the way, let's say that our GPS tells us to make a right on Broad Street. And we get to the intersection where we need to make the right on Broad Street, and there's a barricade there. There's the police officer standing there saying, you can't make a right turn there. We have to adjust our strategy. So one tactic might be to ignore the police officer, make a right, and keep going. Probably really not a smart tactic. Another tactic would be to make a left and wait for our GPS to redirect us as to where we're going. So if we think about these terms, particularly the words strategies and tactics going forward throughout this presentation, it makes a lot of sense. We need to have a plan. And we need to have things that we can do in order to help us execute that plan and to understand that sometimes, in fact, most times, plans don't go as we originally thought. I have literally done thousands of events in my career, and I have never had one go perfectly as planned. And again, in the world of hospitality, in the world of tourism, we need to have plans, we need to have goals, objectives, and strategies. But the most important thing that I've had to learn in my career, and I think many of you have had, particularly right now, is what do you do when there's an obstacle in your way? So today, hopefully, we'll look at some of those obstacles and we'll talk about some of the things that we might be able to do to help you overcome those obstacles. So when I looked at strategic solutions to ensure event success, there's dozens of them, and we certainly don't have time to cover dozens of different strategic questions and sets of strategic solutions. So I decided to kind of focus on two of these, and we'll spend the rest of our time together looking at these two strategic questions. First one, how do we create a safe and secure environment for our guests? Because at the end of the day, as we all have certainly learned, without guests and customers, we don't have a business model. So what we've got to do is, what can we do going forward to make sure that our environment is as safe and secure as humanly possible? And then the second question that we'll look at towards the end of the presentation is, how do we reduce legal and insurance concerns as we reopen live events and venues? Okay? So the first question that we want to look at is this one. How do we create a safe and secure environment for our guests? So again, I want to dive a little bit into some definitions. Again, 3 little boxes up here on the screen with a total of 7 or 8 different words. I want to look at all of these terms and again, make sure that we understand what these terms mean and why they're important to us. And again, not going to dive into complicated technical definitions of any of these words. We're going to really keep it as simple as possible because again, I have found that that tends to work better. So the first box we're going to look at, again, it's on the left of my screen, assuming it's on the left of your screen. But anyway, it's risk management versus crisis management. These two terms are very often confused. They're almost always used in conjunction with each other. You very rarely hear the term risk management without hearing the term crisis management. But I think it's important that we recognize that there are two very clear definitions, very different. So when I talk about the world of risk management, and I spend a lot of time talking about the world of risk management, I am not a research specialist, but it's an area of expertise that I've developed over the years, and I've worked with a lot of clients and organizations, small and large, around the world talking about risk management and crisis management. So when I talk about the concept of risk management is basically everything that we can do in order to reduce or avoid the chance of bad stuff happening. Okay? And you can fill in your own concept of what bad stuff happening means. I also don't define it as eliminating risk, because in the pre-COVID world and probably in the post-COVID world, events and anything associated with food and beverage, hotel stays, any of the kinds of things that we talk about, those things exist in a risk-rich environment. There's risk in almost everything that we do. And as we're now finding out in this life of COVID and pandemic and isolation and all of the other things that we're suffering through, there's no risk because there's no events. But when we get back to doing events again, there is a risk in anything that we do. So risk management does not talk about 100% eliminating risk. That is absolutely impossible to do. The second term up there, crisis management, is basically everything that we do when something bad does happen. And you notice I use the word when something bad happens, not if something bad happens, because bad things happening is a very common occurrence in our business. We hope that that bad thing happening is not a horrific, horrible thing. And that's what risk management is about, mitigating, good legal word, or reducing the risk of something bad happening. But when it does, that's when we kick into crisis management mode. Okay? The second box, the one in the middle right there, and that's easy because I don't have to deal with right or left, but the middle box talks about safety and security. Again, two words that are typically said in the same sentence. You very rarely say safety in our industry without saying security. But again, although the two of those things are very closely related, there are differences among them. And it's important that we recognize the differences, because when we talk about strategies in COVID, most of them are safety strategies versus security strategies. And safety is basically what prevents us or minimizes rather the risk of an accidental occurrence. Okay, so if you hear the word safety, it deals with accidental occurrences. And typical accidental occurrences at events or event venues. Number one, insurance claim, people tripping, falling, and getting themselves hurt. Okay, can we 100% eliminate that risk? Probably not. But there are things that we can do in order to minimize that particular safety risk. So other safety kinds of things that we think about, if we operate outdoor venues or outdoor events, weather-related risks are safety risks. If we're doing an outdoor wedding or an outdoor social event and lightning and thunderstorms happen, very often when we have to remove or evacuate people from our premises, people trip, people fall, people get themselves hurt. Those are safety risks. Security risks, on the other hand, are very often the ones that get more press and get more media attention. And when we think, unfortunately, about security risks, our heads immediately go towards terrorism kinds of things. Okay? So safety is accidental, preventing, minimizing accidental things, where security is about minimizing deliberate threats. Again, active assailants, and that's in the industry. People are using the word active assailant versus active shooter because more and more attacks at events and venues have been knife kinds of things or hammer attacks or vehicle attacks. So the terminology in the industry has really become active assailant versus active shooter. But those are deliberate acts, obviously. And so again, safety, accidental, security, deliberate acts. And then the last box over there, again, my right, proactive versus reactive, relate directly to the concept of risk management versus crisis management. Proactive, which is what we're talking about from the title today, proactive strategies are things that we can do in advance. So risk management is a proactive strategy. Reactive, obviously, is what we do once something's happened. So crisis management is a reactive strategy. Okay? So hopefully the definitions are understandable. So the next two slides that I want to share with you are screen captures. They are from a webinar that I participated in back in early part of June. It was put on by an organization called Event Managers Blog. If you don't subscribe to that, please email me or reach out to me. My contact information will be at the end. I will be glad to get you that information. It's a great resource for people in tourism, for hospitality people, for event people at any level. It's owned by Skift, which is actually one of the best and biggest travel newsletters that's out there. You can get 4 or 5 articles for free. There's a minimal cost to get unlimited. But they did this webinar back at the beginning of June. They surveyed 1,000 event producers from around the country, and they posed a couple of questions. This is the first question that they asked. What is the biggest obstacle for resuming events? And again, I apologize that the 4 is kind of off to the edge there. Screen captures don't work all the time. So as no surprise to me, certainly, and probably no surprise to you, the number one thing that was on there was concern over the safety of attendees and stakeholders at 45%. So again, I'm not going to do the math, but it probably adds up to 55%. So the first one was as great almost as all of the others put together. But in the pre-COVID world, had we asked that question, safety of attendees and stakeholders is always the number one concern we should have in any event-related thing. Because if we cannot provide as safe as possible an environment for our guests, they weren't coming before the pandemic, they're not coming after the pandemic. The other four things that are up there, we probably didn't even begin to think about before the world of coronavirus. Who thought about physical distancing? Okay. Who thought about travel limitations? We would travel forever unlimited. Okay. Not worth it at lower capacity, and the expenses. The two last things are a huge concern. And if I was going to add a third strategy, which we would not have the time for, we would look at revenue. We would look at profit and loss. It's one of the biggest concerns, both with small businesses and with large businesses these days, is how do we reopen in a financially successful manner with lower capacities? Again, New Jersey, as of Friday, is at 25% or 150 people. A lot of places around the Commonwealth of Pennsylvania are at the same levels. Hopefully, Philadelphia will start to open that up soon. But if you have to invest in safety and social distancing infrastructure, we'll talk about what some of those strategies are in a few minutes, is it worth it at the lower capacity? Again, that's a topic for another conversation, and can certainly take up many, many hours of our time. And if you have figured it out, please let me know, because you will make yourself a very, very wealthy person. The next one I want to look at is this concept of which of the following things would make you feel most at ease about social events, about physical events, rather. So again, COVID-19 vaccine, 51%, higher than all of the others combined. The vaccine question is an interesting one. So I'm going to talk a little bit about vaccine, and then I'm going to talk a little bit about the last one that's on there, that real-time viral testing. So the whole concept of a vaccine, great. You know, if we listen to some of the epidemiologists, which is a word I never knew before coronavirus, and now I hear it almost every day, we might have a safe vaccine by the end of 2020. Are people going to immediately run out and line up for that vaccine? I'm not, and I want to go to physical events as much as anybody on this call and as much as anybody that I know. I'm not going to be the first person in line, because we are fast tracking it. Hopefully they will be safe. Hopefully they will be effective, but recognize that many vaccines, the flu vaccine, for example, and get a flu shot, little aside there, are about 50% effective. So are people going to want to take a relatively unproven vaccine for 50% efficiency at a disease that has a 1 to 2 to 3% mortality rate? Something to think about. And the last thing that's on there was 9% back in June, because quite frankly, there were no effective real-time viral tests. Test results take a while, anywhere from a couple days to a couple weeks, depending upon capacity. But literally yesterday, I read an article somewhere, I don't remember where it was, but it talked about the fact that there is a company in France that is working on and is in like third level testing for literally a real-time viral test. They are talking about the fact that within less than 24 hours, somewhere in the 12 to 14 hour range, you will be able to get a very effective test. Not there yet, they haven't got approval, but it is in the final testing phase. So again, that number will come up, and that number is what's really important to reopening our businesses, your businesses, because you can't wait two weeks for a test. You can't wait 2 weeks for employees, you can't wait for staff, you can't wait for volunteers. What are you going to do? So that real-time viral testing will be an important part as we go forward. So in order to really look at this and to be strategic about what we're doing, we have to look at history. We have to look at the pre-COVID world and recognize that when we look at the pre-COVID world, the safety protocols that were in place and the security protocols that were in place were important. So if we go back, and it seems like thousands of years ago, but it was only March, back when we were doing live events, from safety protocols. We wanted to make sure that we had a hazard-free environment so that there weren't electrical cables stretched across where people were walking. So we reduced the risk of people tripping and falling. We wanted to make sure if we were operating larger events that we had some kind of bag checks or metal detectors, or something to screen people for the deliberate bad acts, the security related stuff. We had lots of strategies in place. Now that we're in the world of COVID, what's important today? And from a strategic perspective, the two things that are most important to me, first of all, is educating yourselves and learning things. Clearly, that's important to you because you're taking 45 minutes to an hour out of a day, switching from Zoom call to Zoom call to Zoom call, sitting in on this webinar and trying to learn from me and from other colleagues about what's going on today. So take the time to learn and educate yourself, because when that magic governmental restriction goes away and the authorities say, okay, we can open, that's not the time to think about your strategy for opening. You want to be ready to go, and many of you are, for whenever the government says, okay, we're ready. And the second thing that we want to make sure that we're doing in that context is making sure that we are being safe and strategic with all of our stakeholders. Guests are important, obviously guests are important, but all of our stakeholders, our staff, if we operate events, our volunteers, the vendors, the deliveries coming in. If we are doing hybrid events today, and many of you may be doing them, I've seen some horrible hybrid events and I've seen some great hybrid events. But some of those hybrid events are taking place in physical television studios or at physical venues. Make sure you are exercising all of the appropriate protocols, and we'll look at specific protocols in just a minute or two. So what's going to be important when we are able to open up again? Recognize that everything we did pre-COVID is still going to be important. It's still going to be important to make sure that we don't have trip hazards in our restaurants. It's going to be still important if we're operating events that we make sure that we're providing as low a risk opportunity as possible. So all of those things are going to still be important. And on top of that, all of the health and sanitation related protocols are going to be added on top of all of those complications in our plans, in our investments, in our finances. Health departments, for example, pre-COVID, health departments, again, if you operate a restaurant, obviously they're going to be there. But in the event world, the health department did not play that big a role unless there were food or beverage vendors involved. In the post-COVID environment, and I hate the term new normal because there's nothing normal about what we're doing. I prefer the phrase next normal because it's a little bit closer for me. So in the next normal, health departments are going to have a very active seat at that planning table and should. Okay, when we are out of this or beginning to come out of this, whatever that near normal, next normal looks like, whether it's 100 people, whether it's 500 people, whatever it is, and as that grows, make sure you've got a health department official that you're talking to. Okay, so I want to look at a couple very specific kinds of things and talk through, one or two of these. Everybody is familiar with these. There's probably not a lot of surprises that are out there. But in our world, some of them make more sense and some of them make less sense. So the first one of those, temperature checks, okay? Where does the equipment come from? How accurate is the equipment? One of the interesting things that I've seen recently is I have a number of colleagues who operate event venues in Florida, okay? Yeah, Philadelphia gets hot in the summer. I recognize that. Florida is way hot in the summer. Okay, Disney is going through this now. They're doing temperature checks. Well, recognize that these temperature checks are external temperature checks. Nobody is taking internal temperatures, nor should they. External temperatures, if you've been standing outside in 100-degree weather in the hot sun, your external temperature is going to be probably a little bit higher than what is safe to be allowed into your venue. So again, think about that. And again, recognize that nothing I am putting up here today is meant as a political statement, okay? Unfortunately, politics has gotten very involved in this thing. These are industry and scientifically accepted ways to minimize the risk of the contraction of COVID or coronavirus, okay? Masks is a political football, as we all know. But masks also present an opportunity. Maybe there's a sponsor out there that's willing to pay for masks. So none of these things are free, obviously. Hand washing stations, how many do I need? I do not have the answer to that question. And the frustrating thing is nobody has the answer to that question because the protocols and health regulations are a work in progress. Hand sanitizer, the comment that I'll make about the strategic placement of hand sanitizers is if you've got a pump that's just sitting there and somebody comes up and hits the pump, and then the next person comes up and hits the pump, guess what? Each person is leaving their little, hopefully not contagious germs on the top of the bottle. I recommend doing what my barber does, and I'm just so happy to be able to go back to the barber again, is when you walk in, he does a quick temperature scan, and then he has the bottle of the hand sanitizer, and he squeezes it on, and then you do your thing and walk away. Again, we want to minimize contact as much as possible. Enhanced cleaning, again, protocols are not out there. Health departments haven't told us yet, how often we have to clean surfaces. In the world of outdoor events, that opens up a whole different can of worms in the whole world of portable toilets. I was not a huge fan of portable toilets before coronavirus. I am less of a fan of them whenever we're allowed to go back to events. But we need a definition of enhanced cleaning. What does that mean? Does it mean how heavily, if we're operating a restaurant or a small venue, how often do we have to clean the surfaces? After every customer, every hour, every 2 hours? Okay, it's a question. Plexiglass screens, the kinds of things that we see in a lot of retail outlets, at an outdoor venue doesn't necessarily work. We may have to put them up at ticket locations or entry locations, something that we have to think about. Contactless payments, those were starting to get important before COVID. Very important post-COVID. Nobody wants to handle cash. You know, if you read any of the statistics on germ content, and I am not a germaphobe, but handling money at this point, people don't want to do it. So none of these solutions are cheap. The last two things I want to look at are this concept of documentation of vaccinations and documentation of testing. Are we going to require people to show vaccination statements? Are we going to require people to document that the fact that they've been tested? A lot of privacy concerns that we have to think about. And quite frankly, we don't know what's going to happen. But again, on that testing front, if they do start to develop this rapid kind of thing, it could really be a game changer for our industry. If you can get results in a couple of hours, you can certainly apply it to your staff. Patrons is another customer, but staff and outside vendors, it's something to think about. So that whole documentation strategy gets to be really interesting, and I certainly don't have the answer to that. So with all of this stuff, with all of the safety protocols that we have to put in place, I recommend you go through this thing called a what-if analysis. This is a huge risk management thing. Sometimes it's called contingency planning. Sometimes it's called an if-then strategy. What you do is all of the strategies that you've looked at from today and from all of the things that you're working, you ask yourself the question, what if? Or if then? If this happens, then we do this. Or in this case, what if A, B, and C happens? So for example, this gives you the ability to develop your plan B, your plan C, your plan D, and on and on and on. Plan A is not enough. We know that in this business. But what if you require masks? Somebody comes up to the entrance to your venue, they have a mask on, they walk into your venue, and they take their mask off. What do you do? Okay. What happens if you've instituted contactless payments and your system goes down? What's your backup plan? So the what-if analysis, the if-then analysis, really addresses contingency planning. And in our world, you cannot have a strategic plan for success without contingency planning. So our last couple of slides look at the second strategic thing, where it looks at how do we reduce the legal and insurance concerns as we reopen live events and venues. Recognize the word reduce, not eliminate, because in our society, in the United States of America, anybody can sue anybody over anything. So the strategies, the next couple of questions we're going to ask are going to give us some solutions, but they do not guarantee that somebody won't sue us. That's why lawyers exist, okay? So we may still get sued if we do the best job that we can, but insurance, risk reduction, all of those things are about preventing us or minimizing the chances that we'll actually lose our lawsuit. So again, recognize we will not be able to eliminate them. So again, I could do 100 questions. I decided to do 3, thought that was a nice number. It is not an all-inclusive list. But first one of these is, what defines adequate insurance coverage? And quite frankly, in looking at the industry, it's very much like the health industry. Nobody has yet decided what the word adequate means. So in looking at it and doing some research on it, in some cases, in some US states, I haven't looked specifically at the Commonwealth of Pennsylvania, language will start to become a little bit more restrictive. And others, there might be little noticeable change on what they talk about as a quote, adequate insurance coverage. Recognize that whatever insurance coverage that you have, pay attention to the changing nature in the course of the pandemic. It's extremely important. Develop a long-term COVID-based health protocol strategy to be implemented for every event, and make sure you document everything, because if a lawsuit ever occurs, the more paper you can lay upon those attorneys, the better off and the more protected you're going to be. And when we talk about the word adequate insurance and insurance in general, make sure you talk to an expert, to your insurance broker. And this is, and nothing against any of these companies, but it's probably not going to be the Geico Gecko or Flo from Progressive. They are not experts in tourism. They are not experts in hospitality. They are not experts in events. And the same thing with lawyers. There are countless numbers of lawyers out there, but most of them don't concentrate on our business. So when you're looking at adequate insurance coverage, talk to people who understand what you do, who understand small business, who understand the fact that you are not multi-billion-dollar multinational corporations. Because lawyers and insurance agents that deal with those types of companies are not going to be the companies that can give you the best advice for your business. And I am not the person to give you the best advice for your business, but make sure you talk to those professionals. So that's question 1. The second question is a really interesting one, and it's one I get all the time, and I'm going to answer it in 2 different ways. Although I'm not a lawyer, the lawyer's favorite words are, it depends. So in this case, it depends. But from a legal perspective, you are probably not going to be liable, because in the world of negligence and in the law, again, I'm not a lawyer, there is this thing called causation or proximate cause, the legal word for it. So if somebody comes to your venue and they say they contracted COVID from your venue, prove it. Did that mean you were in complete and total isolation for 2 weeks before you walked into my venue? That you don't have other family people who are out and about? You didn't go to the grocery store? You didn't go to your daughter's soccer game or soccer practice? Okay, think about that. Proving cause is really, really difficult. Not impossible, but really difficult. But the second part of that, which is almost as important, is the public relations piece. If somebody goes to the press and says, I got COVID at this thing, bad for PR. Okay, so again, on the legal side, probably not. On the public relations side, it could be a nightmare. Then the third question is, can I get COVID protection insurance? This is a really pretty easy answer, probably not. Unless you have language in either your contract, like cancellation clauses, or in your insurance about global pandemics, you're probably not going to be able to get it in a contract or an insurance document going forward. Okay? So whatever we do here, whatever rules we put in place, it is absolutely essential that we enforce those rules. So from a legal perspective, you post a sign outside your venue that says, no one will be admitted without a mask. And then you admit somebody without a mask. then you are going to be proven liable because you did not enforce your own rules and regulations. And as either a private venue or quite frankly, a public venue, if you put up the appropriate signage, if you promote it on your website or wherever people go to get their tickets, you can prevent anybody from doing anything. At a bar, you can put up a sign, we refuse to, serve intoxicated patrons. If you are a venue, look at the big ones, the sports venues, they put up signs and they do checks. Although in the Commonwealth of Pennsylvania, you can legally carry a weapon with a permit, you can't bring them into those facilities. So you have the right to refuse entry to anybody. So last couple of slides, how do I know what to do? Okay, it's a huge question. Go to trusted resources. And I mean by trusted resources, not political resources. Again, we have to listen to government. They're important in what they do. But the media skews things the way the media wants to. Not being political, whatever side of the spectrum you fall on, you have your favorite media sources. Are they giving you 100% accurate information? I don't know. Many of them are. But I like to go to the sources. I get a lot of scientific information. I go to the World Health Organization. I go to the CDC, and yes, there's politics involved with them, but they're scientists. And I go, quite frankly, Johns Hopkins Medical Center, University of Pennsylvania, they put out some great documentation. I also go to my industry resources, professional associations, resources like SBDC, or the Center for Hospitality Resilience. We all have a lot of information that we get from academic sources and from colleagues around the world with professional associations. So there is information out there. So ask the questions. And then lastly, remember these two things. They're really important. Hope is not a strategy. That's quoted by a lot of people. This particular thing says it was Vince Lombardi, the former coach of the Green Bay Packers. I don't know who originally said it. Okay? Lots of people take credit for it. I get it. Most recently out of a book called What to Do When Bad Things Happen, written by a really good friend of mine who knows a lot about bad things happening. Before he started his independent consulting contract, he was the senior vice president of special events for the National Football League, Super Bowl, little things like that. And he wrote it based upon the Super Bowl halftime show in New Orleans several years ago when the lights went out after Beyonce's halftime show. And he was live on television being interviewed. So hope is a great thing to have. We all need to have hope, but it is not a strategy. It's not a solution. It's not a tactic. It's not a goal. It's not an objective. We need to have hope, but we also need to have concrete planning in place so that we can execute that hope when it comes to pass. And then the last thing that's up there, and then we'll open it up for questions, is recognize that you are not alone in this thing. I've seen the term, don't say we are all in the same boat, because we're not. Each and every one of us, as many people that are on this call, each of you is an individual in your own situation. What they say instead of that is we are all in the same storm, because the storm is everywhere. It is affecting every industry. There are, and if you are in this group, my heart really does go out to you. People have lost jobs. Many of us in this industry have lost jobs. Many have family members who lost jobs. Many people are figuring out how to make their next rent check or mortgage payment. That's really hard. It creates incredible mental and emotional stress in people. So one of the things that you have to do, and this is a strategy that I talk to my undergraduate students, my graduate students, my colleagues about all of the time. Do not think that you are alone in this. Nobody has the same situation that you have, but there is empathy out there. So make sure that you're reaching out to friends, to colleagues, to professional associations, to great resources, because our mental health right now is really fragile. Our emotional health these days is really fragile. And if we cannot take care of our mental and emotional health, we can't take care of our physical health. So recognize that in this struggle as we go through this, and we've been in and out since March, I can't tell you when we're coming out of this. I wish I could. It's one of the most frustrating things to me as an event planner. Event planners are control freaks, and I have no control over this situation. But recognize that you're not alone. Please reach out. My contact information is going to be up in a couple of slides. If you have any questions, any concerns, anything that I personally can help you with, or if you need a resource or if you need a referral, I can't hire you. I don't have that ability. But anything short of that, I will send you information on where you might be able to get hired. Please reach out to me, and please reach out to, I speak for my entire faculty, many of whom have done these. We all care about you. So please recognize the fact that you are not alone. So Olivia, if there's any questions, I can try and address them in the next couple of minutes that we have. I'm actually going to go to my next slide so people can get contact information. Reach out to me at any of those. I don't put Facebook up here because I don't really use it much. But again, reach out to me on any of those things. So I'll try and answer a few questions if we have any.
Thank you so much. There was one question during your presentation, back to one of the screen capture slides about the obstacles to resuming events. They just wanted to know who had conducted that survey.
It was done by the event manager blog. EMB is what they go by. Again, it's a division of SCIF, which is a travel and tourism newsletter. So they did the survey. And again, the survey was done at the end of May for a presentation at the beginning of June. So have the numbers changed? Probably. And my guess is, and listening to the people at Event MB, Event Manager Blog, they will probably conduct a similar survey. They've talked about somewhere in the September range. And again, if you're interested, I can certainly give you a link to that particular blog. It's a great one. It's really not academic at all. It's really basic, and it's geared towards every size business.
Awesome, thank you. Any other questions? Feel free to just type them in the chat box there. In the meantime, I have posted a link to our website where people can watch previous webinars and get some information about future webinars that are coming up. Okay, let's see. Have you used, let's see.
Force majeure.
Thank you. Have you used force majeure in agreements, and do you see this being added into your contracts more?
First, you should always have a force majeure clause in your contract, before COVID, during COVID, after COVID. The ability to utilize that clause for COVID-related kinds of things is literally an ongoing litigation in a number of different cases. So it has not settled. And again, as I said earlier, disclaimer, I am not an attorney, but I talk to a lot of them, particularly entertainment attorneys. And there's a lot of debate in the legal world as to the enforceability of utilizing coronavirus or COVID-19, whatever you want to call it, as the ability to execute that force majeure clause. If it is in a venue clause, if you my first thing before you get lawyers involved is to talk to A, the client, or B, the venue, and kind of talk it through. Because again, as we all know, and I'm not trying to keep lawyers from making a living, when you get lawyers involved, it's more timely and more costly. So yeah, force majeure clauses, I think, are going to be looked at in detail going forward. But the final wording, again, it's a work in progress. But whenever it comes out, make sure that you're utilizing the most current and up-to-date force majeure clauses. So talk to a tourism attorney, hospitality attorney, restaurant attorney, event attorney, again, not a generalist attorney.
And Ira, and to all the attendees, I just added a YouTube link to a webinar we did early on with the pandemic that touched on this quite a bit. So posted that link below.
Thank you, Jamie.
Any other questions here? I am also going to post a link in this chat box to a survey that we would love for everyone to take for the Center for Small Business Development Center. In the meantime, all right.
Olivia, I also just posted a list to our updated daily Google resource page, and that has links to our upcoming webinars. So while people are thinking of their last questions, I will review some of the events that we have coming up that may be relevant, especially to attendees, because we do have an event on the 16th, designing a COVID-19 compliant event. So that might be particularly relevant to people on this webinar. We also have basics of building a website this month, basics of selling online, how to build your own CRM, and we're also doing tourism and hospitality workshop at the end of the month with focusing on the LGBTQ target market.
Great, yeah, and as I said earlier, now is the time to one of the things that I've spent a lot of my summer doing is educating myself. My business is to educate students. In order to do that well, I need to be educated. I need to be current. And again, it's a daily changing situation. So the resources that SBDC has available are really, really relevant, really good. And again, I've got a ton of other resources that are out there. I can share some of those certainly with Jamie to post. World Health Organization has a really good course in risk management as it applies to COVID related kinds of things. I went through it. It's less than an hour. They talk about mass events, but it's scalable. They give you a lot of resources. They actually have like a risk decision-making tree. I'm recommending it to everybody. I posted it on my LinkedIn and Twitter feeds, and I got it. I got like 150, likes or shares on it. So again, you can reach out to me on an email or on LinkedIn or whatever, and I'll be glad to share that. And I can also, again, share that with Jamie so she can add it to the resource list that's available.
Yeah, that would be excellent. And we do have, besides the trainings, we also have one-on-one consulting that's available, and that is also a no-cost service. And we're able to do this because we are funded by the federal government, the Small Business Administration, and that is also why our surveys are important. So it's a really brief survey, 4 questions, and we do need you to complete that for us, and we'll send that out in the follow-up along with the white pages and the recording.
All right, well, it looks like there's no further questions. I guess we can wrap things up here. Thank you so much, Ira, for being here today, and thank you everybody who has joined us.
Yes, thanks for being on the call. I appreciate it, everybody. Have a great day. Stay safe and healthy.